Hello, my name is Phillip Ge, and I would like to take a few minutes today to discuss our research study titled The Suture Pulley Countertraction Method Reduces Procedure Time and Technical Demand of ESD Among Novice Endoscopists Learning ESD, a prospective randomized ex vivo study. Before we get started, I would like to thank and acknowledge our co-authors, Dr. Christopher Thompson, Dr. Pishimaljiro Pinho, and Dr. Hiroyuki Aihara. First, a little background. The lack of reliable countertraction in endoscopic submucosal dissection, or ESD, contributes to its technical demand and increased procedure time. The suture pulley countertraction method was previously shown in an ex vivo study to facilitate ESD when performed by an expert. This was published by Dr. Aihara and colleagues in GIE in 2014. However, its utility among typical endoscopists learning ESD in the United States remains unclear. Therefore, we aim to prospectively evaluate the efficacy of the suture pulley countertraction method in endoscopists new to both suturing and ESD. This study was based out of Brigham and Women's Hospital in Boston, Massachusetts. Participants included both senior GI fellows as well as attending gastroenterologists recruited within the institution as well as from outside ESD courses. ESD was performed on 2 standardized 30mm circular lesions in an ex vivo porcine stomach model. Participants were randomized to perform ESD using either the traditional method or the suture pulley countertraction method first, and performed ESD using each technique. Participants were supervised by a single expert. However, they were required to complete both procedures without assistance. Our primary study outcome was total procedure time. We also recorded individual times for circumferential incision, for suture pulley placement, and for submucosal dissection. Following completion of each ESD, participants graded the difficulty of the procedure using the NASA Task Load Index. This is a validated quantitative scoring system that is used to evaluate the workload in a procedure. It comprises 7 factors: mental demand, physical demand, temporal demand, performance, effort, frustration, and technical difficulty. Each factor is rated on a 10-point scale, with 0 being lowest or easiest, and 10 being highest or hardest. We recorded as well any incidences of perforation, piecemeal resection, or failure in suture pulley placement. A total of 13 participants, including 8 fellows and 5 attendings, were randomized such that 7 performed traditional ESD first and 6 performed suture pulley ESD first. The mean total procedure time was significantly shorter using suture pulley ESD compared to traditional ESD for all participants, with a mean total procedure time of 26.7 minutes for suture pulley ESD compared with 59.4 minutes for traditional ESD, with a p-value of less than 0.001. This was true for both fellows as well as for attendings. When the total procedure time was subdivided into individual steps, submucosal dissection time was significantly shorter using suture pulley ESD compared to traditional ESD, with a dissection time of 8.4 minutes for suture pulley ESD compared to 47.2 minutes for traditional ESD, again with a p-value of less than 0.001. Again, this was true among fellows as well as among attendings. The suture pulley required an average of 6.2 minutes to place. There were 4 perforations during submucosal dissection in the traditional group and no perforations in the suture pulley group. This trended towards significance with a p-value of 0.096. There were no inadvertent tears at the fulcrum or anchor point in the suture pulley setup. The total NASA Task Load Index scores were significantly improved using the suture pulley method compared with the traditional method, with a total score of 29.9 in the suture pulley ESD group compared to 50.7 in the traditional ESD group, with a p-value of less than 0.001. When subdivided into individual components, as you can see here, there was significant improvement using the suture pulley method in all 7 categories. There are multiple pertinent discussion points with regards to our study. First of all, the suture pulley countertraction method significantly reduces procedure time and technical workload among endoscopists considered to be novices in both suturing and ESD, including both fellows and attendings. Specifically, this method appears most effective at reducing the amount of time required to perform submucosal dissection. Second of all, by helping to expose the dissection plane, the time investment required to set up the suture pulley pays off by facilitating submucosal dissection. This is evident in the NASA Task Load Index scores, which show decreased mental, physical, and temporal demand, improved performance, and decreased effort, frustration, and overall technical difficulty. Third of all, by facilitating exposure of the submucosal dissection plane, the suture pulley method may increase the safety profile of ESD among novices, as evidenced by the lower perforation rates among suture pulley ESD, which trended towards statistical significance. There have been multiple countertraction techniques that have been described in the existing literature. As you can see from the illustration, in traditional ESD, exposure of the submucosal dissection plane requires careful attention to positioning and to the effects of gravity. The suture pulley method is unique among countertraction techniques in that it utilizes a fulcrum point, as you can see right here, which then gives the assistant the ability to control and vary the amount of countertraction needed during submucosal dissection, simply by adjusting the tension of the suture tail. This ultimately translates into a wider, more visible, and potentially safer dissection plane. The main strength of our study is its randomized prospective nature, and our findings which demonstrated that this method is useful for all endoscopists regardless of their experience. Limitations include the ex vivo nature of the study, the fact that although ESDs were performed by endoscopists considered to be novices, they were supervised by an expert and performed the procedures in a standardized and controlled setting, and suturing device-related factors, such as the additional expense of the device, familiarity with the device, and the learning curve associated with endoscopic suturing. In conclusion, the suture pulley countertraction method significantly decreases both the procedure time and the technical demand of ESD among endoscopists at all skill levels who are new to ESD, findings which may have potential implications for ESD training in the United States. Larger human feasibility studies are necessary to further validate our results. Thank you very much for your attention.